This patient has an infiltrate in the right base close to the diaphragm. Note that it is triangular in shape and that the base is towards the right hilus. Under proper circumstances, when we see such a finding, we must suspect pulmonary thromboembolism. And this density may represent the area of infarction, the convexity being the so-called Hampton's hump. This patient died, and a macro section of the right lower lobe shows the classic triangular shape of a pulmonary infarct. The two sides of the triangle are the diaphragmatic and the costal surface of this segment. The base of the triangle is convex towards the hilus, and that convexity was described by Professor Hampton from Boston many years ago and has been considered to be the so-called Hampton's hump. Note that this segment is filled with the blood, and there are very few air spaces that remain visualized. The overall size of this segment is smaller than the original size of this segment. When hemorrhagic necrosis or infarction occurs, what one gets what has been described by the pulmonary physiologist as a congestive atelectasis. Congestive atelectasis has two opposing forces. Congestion means increase in blood that will tend to increase the size of the affected segment or lobe. Atelectasis is produced by the loss of surfactant. It's a peripheral form of atelectasis, which will tend to reduce the size of the affected segment or lobe. Which of the two predominates? The atelectasis. So invariably, when we have a pulmonary infarct, there is a tendency for seeing a reduction in the size of the affected segment or lobe. Another patient where we can see the Hampton's sign of pulmonary infarction and the abrupt cutoff of vessels, something we also see associated effusion. So we can then make a specific diagnosis of pulmonary embolism by pulmonary angiography, helical scanning, and electron beam computed tomography. We have exquisite modalities that are expeditious. They require the injection of contrast material, but they can safely replace pulmonary perfusion scans for the diagnosis of pulmonary embolism.